In this video, I'm going to go over 4 knee exercises for pain. I'm Dr. Sebastian Gonzalez. Now again, this exercise video is not intended to strengthen the knee, it's mainly to mobilize the knee and decrease pain. The first knee exercise for pain I'm going to go into is resisted flexion and extension of the knee. If you don't know what flexion and extension is, this is extension and this is flexion. And you can do this from a lying down position, but for video purposes, I'm going to stay up here. Okay? So what I like to do is get yourself a nice comfortable position. A lot of videos don't show that you actually need to have the trunk rigid, like if someone's punching you, to be able to accomplish this correctly. For the rope, you can use a strap, you can use a belt, you can use a lot of things. As long as it's rigid and you can provide some resistance, that's good enough. So all we're going to do is we're going to start with the knee in a non-painful position, and we're going to pull on this and let the knee come with it slowly. And then we're going to go back down. Always providing some resistance and producing really slow motions. Now, one common mistake I see is people just let it go, okay? Strength is also in regards, it also happens in a lengthening motion. Right now we have a couple muscles lengthening. Right now we have a couple muscles lengthening, okay? Now you can increase over time range of motion and resistance. Range of motion would be, we might start with the very slow or very low range of motion, really shallow flexion and extension of the knee. And then we might go to larger ones over time. Next, you might use more resistance. And to do this, I usually put the rope a little bit further down on the foot to make sure that you're not really jamming in on the ankle in case you have any ankle conditions. And now we're slowly letting the rope win in each direction. The second exercise for the knee for pain I like is knee mobilization, or kneecap mobilization. And the kneecap is right here. I'm going to turn a little bit to the camera so you can see. And actually I'll do it first on the ground so you can see it, and then I'll actually zoom in on it. So what I like to do is start with the knee slightly in a bent position right here. You can actually put something underneath it, say a pillow or something of that nature. You want to keep the knee in again, a non-painful position. So we're going to take both the fingers and we're going to slide first. We're going to go this way and this way. So we call this laterally and we call this medially. And it's really good to have the knee in a non-active position, meaning that the muscles around it are not guarding. Right now, how I have my leg, I'm fighting to keep it up against gravity that will pull it down, and it'll make it so the kneecap doesn't move as much. So we are mobilizing the kneecap, so we want to keep this relatively loose. Okay? So we're going to push to the side this way. We're going to push to the other side. Then we're going to gently push down and gently push up. I'm going to do this from a standing position in the camera so you can see. Okay? So we're going to push it this way, which is laterally. Notice that you just put your fingers on the outer part of the kneecap and you're pushing very gently across. We're not jamming it straight in. Next, we're going to take double finger contact and go to the other side. About 10 oscillations is pretty good. Then we're going to take it from the top and just press it down this way. Next, we're going to take it from the bottom and cup it with the 2 fingers. I'll pull this up so you can see. And we're going to pull it up. None of these should be painful. It's just mainly just getting this thing to move around a lot. As you can see, my cap moves a lot when I relax the quad muscle up here. When I contract it, it's not moving anywhere. Okay? Relaxed versus not relaxed. Now in 3 and 4, we're going to go into active stretching of some of the knee musculature. Passive stretching, which is known as static stretching, would be more of like, say, this. Now, there's nothing really wrong with static stretching, but it's kind of on its way out. A lot of healthcare providers like more active stretching better because we're using the muscles on the opposing side of the joint to be able to produce the motion or produce the stretch on the front side or the back side or whichever one we're doing. In this case, we're going to do the quad first. Remember, it's always important to contract the abdominal wall and make your torso rigid while you're doing any of this stuff. Because when you do actually stretch into flexion of the hip or extension of the hip, then you're also going to get possibly some trunk changes, which is not ideal. So here's how we stretch the quad actively. Now, in a sideline position such as this, let's make sure I'm in the camera. Got it. Okay. Make your head nice and comfortable. Put your hand right here. I want you to exhale and make it so you're actually pressing your abdominal wall into your hand. I'll raise my shirt a little bit so you can see. So right here, I'm rather slack. Here, I'm more compressed against it, being able to breathe. I'm pressing still into my hand rather than extending the trunk. That's really, really important. Okay, find this position, keep pressing into the hand. Now you're going to bend the knee with the hamstrings in order to stretch the front side quad. Okay? This is a pretty simple one. We're going through as much range of motion as you can do actively without irritating the joint. Now, if you want to add a little bit more flair into it, you can add some hip extension. I'm coming back towards the camera now. Okay? It's almost like we're kicking a soccer ball. Notice that I'm keeping this elevated up, which is still engaging some of this outer glute musculature, which is really, really important in regards to strengthening the knee. And as you see through some of the videos to come, we have to strengthen the trunk and the hip to really prevent the knee from further damaging itself. Got it. So that is active stretching of the quad. Active stretching of the hamstring can happen from a supine or face-up position, such as this. So I'm laying on my back. Notice this rib cage right here. We want to make sure that's depressed all the way down, so that you can do that with a cough or an exhale, or a got it down. Putting the hands on the sides, pressing into the abdominal wall from the sides. Take a couple breaths. Notice that my hands are expanding this way rather than sinking in while my ribs are flaring. Okay? As you do this now, we're going to engage the hip flexor and lock out the quad and bring the foot into the air and slowly lower down. This is very similar looking to a passive hamstring stretch where people typically will press your leg up over your head. And again, that's a passive stretch or a static one. It's kind of on its way out. This is the better way to do it at this point in time. I'm sure everyone will change their mind in about 10 years. Okay? So those are the four exercises, those are the four exercises, the knee exercises I like for decreasing pain. Again, that is not for strengthening the knee per se. It does help strengthen the torso and the hip, which is really, really important in decreasing knee conditions in the first place. If you have questions for me, feel free to go on to my website, p2sportscare.com. You can submit a question for the podcast or for a video demonstration, okay? Let me repeat that again, p2sportscare.com. We have courses on there as well. There is one coming out on runner's knee. So if you do have an issue with the knee, it's really, really important to understand your pathology, your injury, and learn how to correct it in a rehab setting such as this. Doing it on YouTube videos, you won't always get everything out of it. I'm sorry, I must be Cassie today. So take care. I'll talk to you guys soon.